I'd like to formally welcome you to the 10th episode of the In Conversation Roundtable discussion, which is going to focus today on working upstream to end homelessness. My name is Carmel Williams, and I am the Director of the Centre for Health and Policies Translation. But before I begin today's topic, I'd like to make an acknowledgement of country. In the spirit of reconciliation, the Centre for Health and Policies Translation, the Australian Alliance to End Homelessness, and the Australian Health, Housing and Homelessness Network acknowledge the traditional custodians of country all throughout the world, and we acknowledge their connections to land, sea and community. We pay our respects to the elders past and present, and we extend that respect to all Aboriginal, Torres Strait Islander and Indigenous peoples from around the world today. We would also like to acknowledge the value of lived experience and would like to welcome those with this lived experience as critical partners in efforts to end homelessness, as they bring nuanced reflections on the challenges they have faced and the impact of system responses and non-responses. So as we move on to today's session, I just thought it would be helpful to give you a little bit of background information about the In Conversation Roundtable discussions. These discussions are designed to bring thinkers, policy actors, practitioners, people with lived experience and boundary spanners together to elevate discussion on emerging issues, present new and upcoming research and facilitate conversation around impacts and possible solutions. The Centre for Health and Policies Research Translations convene these sessions approximately 3 times a year. To date, they've been a real mixture of invitation-only meetings and publicly shared webinars. And today's webinar is one of those publicly shared ones. And that we believe by bringing senior policymakers together with researchers and implementation experts, we're able to really highlight new ways of thinking and elevate topics of shared interest onto the political and community agenda. For this 10th episode of the In Conversation Roundtable, we've been really privileged to partner with the Australian Alliance to End Homelessness and the Australian Health, Housing and Homelessness Network. Housing is both a basic human right and a foundation for well-being. It provides shelter, security and a sense of belonging. Yet despite these really important considerations, homelessness remains a significant issue in Australia and other places around the world. Beyond the immediate lack of shelter, it reflects deeper systemic issues surrounding housing affordability, income inequality, family and domestic violence, and inadequate access to support services. These underlying causes highlight the need for the application of a public health and prevention approach to address the root causes of homelessness. What do we mean by upstream? Upstream efforts refer to creating impacts and strategies that really improve the conditions in which people live their daily lives. By addressing these conditions, often talked to and referred to as the social determinants of health and well-being, through the application of laws and regulations, policies and delivery of system changes, we're able to hopefully make inroads into the causes of homelessness. Current homelessness initiatives are often focused at the crisis centre, the crisis end of the issue, which is really essential, and we're not challenging that. However, we're trying to argue that it's equally important that we think and work upstream to end the causes of homelessness. If the drivers of homelessness are not actively tackled, then individuals and communities will continue to fall into homelessness. We're really privileged to have a range of roundtable speakers and expert panelists join us today, and I'll introduce each of them to you shortly. And then following, each of the speakers will speak for a few minutes, 4 to 6 minutes, and in some cases a bit longer. And then following the brief presentations, time has been allocated for discussion and dialogue between the speakers. So please place your questions in the chat as you're listening to the panelist, and we'll try to respond to as many of your questions as possible. So our first speaker today is David Pearson. from the Australian Alliance to End Homelessness. He's the CEO. David has a passion for social justice and recognises that ending homelessness is possible and that homelessness is not normal or something that we should accept. He has worked towards this goal in a range of roles in the community, government, university and philanthropic sectors. Following David, we'll be joined by Peter Mackie from Ruff Institute of Global Homelessness. Peter is an internationally recognised expert in homelessness and housing policy and has an extensive background in prevention, systems change and housing, and a genuine commitment to work alongside communities and governments to end homelessness. Peter is the Executive Director of the Ruff Institute for Global Homelessness and has previous experiences across a broad range of voluntary and academic fields. Bev O'Brien from the City of Salisbury, here based in Adelaide, will be the third speaker in today's session. Bev is the General Manager of Community Development at the City of Salisbury, a local council based here in South Australia. She has an extensive experience as a senior leader in both local and state government settings. She's a former social science researcher and has worked in the private sector, and so brings a really broad and diverse experience. Bev is passionate about improving the lives of local communities and works to make a positive difference and to address the complex societal problems that our communities are facing. Our last speaker is Elias, Luke Elias from the Healthy North Coast, a primary healthcare network. He's the Director of Operations and Engagement in that primary healthcare network and has worked extensively in clinical capacity, health management and administration roles in both the public and private sector over the past 2 decades. Luke is dedicated to working collaboratively and improving health experiences and outcomes through the provision of best practice programs and models of care. So these 4 speakers will run through the sessions first, and then we'll have a cross-cutting conversation with the speakers. And finally, we will be joined by Associate Professor Selina Tuali, who's a Deputy Director from the Centre of Social Impact based at Flinders University here in South Australia. Selina will be our raconteur for today. Selina is a geographer, a social researcher and an evaluator with experience in housing, homelessness and community development research spanning 20 years. Selina's expertise is co-designing and co-creating better programs, places and outcomes for disadvantaged and vulnerable people and communities. And for many years now, which has involved policy and practice relevant work to end homelessness. So what I'd like to do is I'll hand over to our speakers very shortly, and David will do, as I said, the first introductory scene setting session, and then we'll run through Peter, Bev and Luke, and then we'll come back for a conversation. I won't be interrupting the speakers. They'll pass from one another. So I think with that, I'll actually hand over to David and ask David to get the conversation going. Welcome, David.
Thank you, Carmel. That was quite a lot of introductions, and what an impressive group we've compiled together today. So thanks everyone for being here. So I'm doing the scene setting. So I thought we're better to start some scene setting with a bit of a why question. And I often get asked, why do I do this work? And the photo that you can see on screen is one that I took when I first took on this dedicated role at the Australian Alliance. And it's of a guy called Jack. And Jack had not his real name, but what I'll use for today. Jack had an experience of homelessness in his youth. He had some trauma in his youth, and at different points in time, Jack was provided access to housing and support. And as the years went on, Jack had some mental health challenges. Those mental health challenges led to him going back out onto the street. And at different times, he wasn't able to access the housing while he was on the street, and his homelessness got worse. And then his mental health got worse, and then it led to some substance use issues. And this is a story that exists in every community across Australia and communities around the world. And the challenge with someone like Jack is that it's not just one issue that he is facing in his life. And at different points in time, he was provided housing. And because he wasn't able to access enough of the mental health support that he needed in the community, that housing wasn't able to be sustained, and he went back into homelessness. And at different points in time, he would be able to get onto of his mental health challenges, be able to kick some of the addictions he might have been acquired over time, but couldn't get the housing. And this cycle of the housing and the support not lining up is that common story around the world and around Australia. And it's what we'd call chronic, long-term, rough sleeping homelessness. And for people who have an experience like this, it can reduce life expectancy by up to 30 years. It is literally it kills people, and it is a public health issue. It is a solvable problem. What my organisation, the Australian Alliance End Homelessness, is about is we're about saying that we can solve this problem, that homelessness is solvable, that people like Jack's experience is resolvable, but we need to coordinate across many systems, not just the housing systems. We need to take a in all policies approach, as Carmel would call it. And so our mission is to prevent, reduce and end homelessness. And we start with people like Jack who have that long-term chronic experience of homelessness. But of course, it's not the only form of homelessness. And we seek to do that work by making any instances of homelessness like Jack's rare, so that there's not many people doing it, having that experience, that it's brief, so that if people are falling into homelessness, we're able to rapidly rehouse them, and that it's once off, that we're breaking that cycle, that we're not sort of putting people on, giving them housing without the support or giving them the support without the housing. That's really our mission. But I guess one of the challenges and one of the scene-setting things that Carmel asked me to talk a little about is, what is the challenge of homelessness? And as I was saying, homelessness, as we like to say, isn't the problem. Homelessness is the result of the problem. Homelessness is what happens when our housing systems fail, when our health systems fail, when all of those systems don't integrate with each other and don't provide person-centred support, if people are familiar with that sort of jargon. But it is a challenging challenge. One of the things we've sought to learn in Australia is what's worked well around the world. And I was really enamoured with, when I first started doing this work and took that photo earlier, with a group of communities called the Built for Zero community, or Community Solutions, in the United States. And they have supported at different points in time 14 communities that have ended homelessness for people like Jack in their community. And, with everything going on in the United States these days and things, it's difficult to picture that. But there are communities, so local government areas this is, 14 of them, that have made homelessness rare, brief and once off for people with a chronic experience. And they've done that through a whole range of different measures and sort of out of scope for today's conversation. But I guess the key lesson I wanted to share from that story is that they ran a thing called the 100,000 Homes campaign. And that success was born out of a sort of failure, if you will. And that failure was the 100,000 Homes campaign. They got 100,000 properties in the United States, housed people like Jack in them, and they have annual homelessness data in the United States, something that we don't have in Australia. And when the data came out, given they'd raised 100,000 properties and been able to house some people like Jack into them, they thought they would have reduced homelessness by 100,000. But what actually happened is they were only able to reduce it by 30,000. And that the challenge because of that was inflow or prevention. We had more and more people coming into the system of experiencing homelessness than they were able to rapidly rehouse as many houses as they could get access to in that community, in that nation, right? So they had this wonderful success of a 100,000 Homes campaign, but ultimately didn't help them achieve the goal of what they were seeking to do, which was to make homelessness rare, brief and once off. So they learned that lesson that we need to count down to the goal of ending homelessness rather than count up to the outcome of housing people. And to count down, you need to do prevention and you need to understand the whole system. So what is the whole system? This is the way they've sought to measure that. Know everyone who's experiencing homelessness in real time, know if we're housing them, know if they're falling back into homelessness. And so prevention or inflow, as we would call it, comes from these different areas. And when you understand who's experiencing homelessness and you can measure it in real time, as we're able to do around the world, what those United States communities are able to do and what we're now doing in Australia, it allows you to triage the scarce resources that we have in the system to help those people that are most in need. It helps us to plan and to advocate. And importantly for today's conversation, it helps us to think about prevention. It helps us to measure our prevention activities or our inflow activities. And the challenge with that is, of course, that we're not just working with homelessness services that are funded by government. We're working with all the services that are involved in a person experiencing homelessness life. Health services, food services, housing, all of them. And so what this slide from some of the training that we do as the Australian Alliance sort of just seeks to show is that there's ultimately three groups that we've got to really try and involve in this work. And if you want to do prevention, you can't just work with one agency and one program. You've got to work at the system level and have data that can measure that. So in Australia, we've been building out the movement of communities and organisations that are building this level of data. I love showing this slide because when I first started doing this work, there were 4 logos, and now there's nearly 30 communities that are seeking to do this work, and many of which are supported by Selena's Research Centre and Peter's Centre globally, and have great partners in the health networks and with local government. All of the people that are part of this call are part of this movement that is seeking to show that homelessness can be made rare, brief and once off in Australia. But what we need to do more of, and what we as a country and what globally we need to do more of, is think more about how do we stop people from experiencing homelessness in the first place? How do we prevent homelessness? How do we provide the care before care is needed, so that people don't have to have this catastrophic for their health, catastrophic for their well-being experience of homelessness? And there's many ways in which we can tackle that. But the last point I really wanted to finish on today, that if we're really serious about solving homelessness, we need to see it as part of the broader movement of solving the challenge of rising inequality in our countries and our societies today. There is no shortage of wealth in today's society. We live in some of the most prosperous times in the history of humanity, and yet we still have our fellow citizens living and dying on our streets. It is not normal. It is not acceptable. And if we want to solve that, we've got to put this in the broader context of a rising inequality challenge where we have a growing billionaires class who are not paying their way. And often our political debates focus on those who look different to ourselves rather than those who have vast amounts of wealth that are not contributing to solving the problems that are solvable on our streets and in our communities every day. With that, I'm really happy to be part of today's conversation. I'm handing over to you, Peter, to tell us a little bit more from your perspective.
Thanks, David, and thanks everyone for the invite. I join you from Wales, though I'm here representing the organisation I'm pleased to work for, which is the Institute of Global Homelessness. It's an institute that works across the world to support cities, countries in their efforts to prevent and end homelessness. And I'm just going to talk through 2 slides today, really to get the conversation going around what we mean by prevention, but also how systems are failing. And so to begin then, we're with the point around what do we mean by prevention. This is a typology that I've worked on with a wonderful colleague, Suzanne Fitzpatrick, over time. And we've worked with governments and cities to use this typology to think through what it is that you're currently doing and what are the opportunities to do better. What are the gaps where we could better prevent homelessness? And there's 5 stages, and it's temporal, it's time-based. And the goal is, how early can we intervene? At the very start, we've got what we call universal prevention. That's things we do population-wide to prevent homelessness. And we talk in particular about 4 protective factors. That's having enough affordable homes in places where people want to live and that people have access to. We often talk about the supply issue. Actually, if we allocated that housing to the people most in need, if need drove our housing supply, we would be fine. So having enough homes, having enough and decent income, whether that's jobs, access to work, or government welfare support, having access to good health, and access to health services when you're facing poor health. And then crucially, one that's often forgotten and is much harder for governments to intervene in is those positive social relations and networks, which are such a key protective factor. Beyond that, we have upstream interventions. They are interventions and supports targeted early stage at those groups of the population who we know are at greater risk. Not through any fault of their own, but normally because of a failing of our systems. And often that is transitions from systems that are creating homelessness, whether that's prisons, health, etc. Or it's young people who we know are at greater risk, family and relationship breakdown. But working upstream, that's where we want to be. That's where we want more of our resources. We then talk about crisis stage prevention. It's distinct from upstream because this is where homelessness is foreseeable. There is some sort of indication that homelessness is coming. Typically there we're talking about eviction notices. You've had an eviction notice. You have no alternative. But it does give us a window of time at which we can intervene. And there is this crisis stage is where most of the prevention activity we've got is happening. Then emergency stage prevention, that's interventions that happen at point of literally, if we don't intervene today, tonight, then somebody is on the streets tomorrow. Of course, that means we've got far fewer options to protect people from homelessness. It's where we end up with B&Bs and hotels, and really at the moment a proliferation of unsuitable emergency responses. And the goal is, as David said, is to make any experience at emergency stage. It needs to be dignified, but it needs to be short. And then repeat homelessness is quite obviously it's about stopping homelessness happening again, making sure that we've got the right social supports, that housing is secure, and beyond. So that's a way in which we've found really helpful to frame conversations. Within each of these stages, we could talk about lots of examples of things going on around the world, but it's a nice framing to get us thinking about what we could do. Now that first slide, the typology, does lead us towards thinking about individual interventions. Oh, we could do this at that point in time. But actually, one of our major challenges is system failure, things not working together as they should. And that is a problem of decades. And again, with Suzanne Fitzpatrick, we've been thinking through, our contribution to this discussion is about why is it, and in what ways are the systems failing? And we've talked about this idea of system dysfunction. And I'll go through a couple of examples, and I know you'll be sat there going, oh my goodness, our systems do this. Like, we need to fix that part. So the first point we tend in our kind of discussion around system dysfunction, and in no particular order, we talk about shunting, and that is where services basically signpost people away. I think in the English language, we've probably got more words for signpost, shunting, etc., than in any other language. It's where services are saying, you've come in the wrong front door. We can't help. And sometimes that's a geographical thing. You're an area, you're a city that says, actually, no, go to somebody else. So that's shunting away. And the response to deal with that is often to place responsibility on an individual service. So, for instance, all over the world, the responsibility for responding to homelessness falls on different departments: social services, health, housing. And it's allocated to an individual service to take some responsibility. That tries to avoid some of the shunting. However, the response to that is what we call withdrawal. Okay, well, if housing have got responsibility for homelessness, health, social care, we don't have to act. It's not our responsibility. So there is an interesting area. In Scotland and Wales at the moment, we've just got new legislation has come in that has placed duties on other public bodies to identify people at risk and act within their own resources to prevent homelessness. It's really progressive, but it's dealing with that withdrawal. Prisons and criminal justice is one of the areas where we see this withdrawal most significantly. The third way in which we talk about systems failing to work together is this uncoordination. Often we've got so many partners doing really quite amazing things and putting a lot of resource, government resource, charitable resource in, and people's time, volunteers, but in an uncoordinated way, often focusing on the same subpopulation at the expense of other parts of the population. And of course, the inevitable response to this is you need a coordinating body, an organisation that makes sure that the whole population is served at the right point in time. So continuums of care in the US is a good example of that. And then finally, we talk about contradiction. And this is probably, they're all frustrating, but probably the most frustrating. That is where you are trying to do something, and you're going to find this the more you go on your homelessness prevention journey. You're going to do something to try and prevent homelessness, and there'll be another part of the system working against you. And if only they would come on board and see the problem with you and act alongside you. So, for instance, you are trying to work on evictions prevention, and then within another part of the system, You've got a part of the state, the local authority, housing authority, whatever, going through evictions processes, and you've spent a whole load of time trying to work against that eviction. That contradiction in services, in systems. One of our big challenges at the moment is the Home Office accommodation responsibility for asylum seekers and refugees. Giving 28 days notice to leave asylum accommodation is working against any prevention agenda. Homeless prevention agenda. So I'm going to stop there. I was asked to speak for 8 to 10 minutes. Really understanding what we mean by prevention, challenging you to work further upstream and earlier, and doing that in a way which is a coordinated system working together with the lens of homelessness prevention. Diolch yn fawr. Thank you very much. I'm going to hand over now to Bev O'Brien from City of Salisbury. Thank you.
Thank you, Peter. I feel like I recognise so many of those dysfunctions and could probably give a whole presentation on just some case studies and examples of those. It's my great pleasure to be here today, and I want to acknowledge that I have had the privilege of working in 3 different local governments within South Australia, all which have chosen intentionally to be really proactive in their efforts to address homelessness. And so these are comments from both myself and colleagues working in the sector. On one level, I think local government has a fairly limited set of formal upstream levers, but there are practical things that we can and are doing that, in my mind, help reduce that inflow that David spoke about already. So I thought I might just touch on 5 things that that local governments have the capacity and the capability very often to do, and I'm mindful of not teaching my colleagues to suck eggs on this one. So I don't think these points are new, but I think they're worth kind of reflecting on. The first, I think we all recognise that affordable and appropriate housing is, one of the primary structural drivers of homelessness. And as local governments, we don't typically supply housing, but there are certainly things that we can do to help bring more housing into the sector. When I was at the City of Port Adelaide Enfield, we had a major projects group where we would bring community development and a range of council departments into the room with developers to talk about how we could encourage innovation, trial different housing products, do things differently, and work within the best way that we could within the constraints of the planning system to make as much social and affordable housing part of any development. The second thing that we've been doing here, particularly at the City of Salisbury, is looking at our own land holdings and whether we could, whether there's any land that we could actually forego and partner with a community housing provider to build social housing. And that can happen at 2 levels. We've got some developments on the books at the moment where we're partnering with a community housing provider and building kind of a dozen townhouses right next to a community centre. And, there's a really good kind of interface there. But one of the things that I learned through talking with colleagues in that sector is that very often those really small housing providers can only afford to have 2 or 3 properties under development on their balance sheet at one time. You only need a really small parcel of land that is perhaps excess to your council needs that could be used to develop social housing. So I think that that's a great thing to be thinking of. And the final point I'd make on that is that often as local governments, I think we can stretch the thinking and the boundaries around those kind of alternative housing products that we might be willing to accept and willing to lead the conversation with our community about why we might do something different on that site. The second upstream thing that I wanted to talk about that's already been mentioned this morning is around helping people to maintain their tenancy and prevent eviction, and both speakers have already touched on that already. It's easier, it's cheaper, it's less disruptive to people's lives and less disruptive to the communities in which they live if you can do small practical things that help people to not lose their tenancy. And so some of the things that I've worked on over time are things like, if we know that there's a group of units with a lot of social housing in it, could we provide free skip bins? Could we have a library of tools? Could we run seminar or sessions on some basic home repairs, things that just help people to keep their housing at a level that's expected of them, that they might not have the skills or the capacity to do. The other, very often what I've experienced anyway, is that funded services come and go, and particularly I think 5-10 years ago there was a lot more financial counselling available, or it seemed to be more available, or tenancy officers to work with people who were at risk of losing their property. And I think when those services, when the funding for those services gets moved around, people lose that connection, and as local governments we lose that connection as well. So keeping those basic services in place is really important. And the final thing I wanted to just touch on there, we've been trialling for the last 12 months a social worker in libraries program together with the City of Adelaide. And that's been phenomenal in those everyday interactions that in our library is part of a broader civic hub. People might come in to pay their rates or register their dog or find local services, and our staff can be really attuned to those early conversations that might tell us that this person is vulnerable or at risk, and we can get our social worker alongside of them really, really quickly, and that's been super helpful. The third one that I'd mention is around building financial literacy and capability. I think the data at the moment tells us about 1/3 of Australian adults don't have the financial skills to meet their particular stage of life. And that means people end up in all sorts of situations where they are scammed, they take out payday loans, they're not as aware as they could be about the energy use in their home and so on. And so I think building that financial literacy and capability is something that local governments can do and should do. The fourth thing I'd mention is around really understanding the local flavour of what homelessness looks like in your area, and that's about those interagency groups. It's about those local conversations. It's about knowing your community profile and keeping really close ties with other agencies. I've had some great experience in the past working with Department for Child Protection, where we've come to know that there's a particular street that has a number of families that are vulnerable and at risk. And, we can pop a really universal general children's initiative in that street party, play street, whatever it might be, and just connect early with families that we might not otherwise see. We talk about, the difficult to reach families. We need to go to them. They don't come to us. And the final part I'll end on, and I'm very conscious, Carmel, that I'm probably going over my time, is really seeing people in their local context and working with them holistically. Rightly or wrongly, City of Salisbury, we've taken the approach that where it is safe for the person and safe for the community to do so, we are leaving people who are sleeping rough where we find them, because what we know is that when we keep moving people on, we lose them. And we've had some amazing successes. I'm so proud of the team. We were recently able to house a gentleman who'd been sleeping rough for 22 years. I just can't imagine what that's like. But we worked with him where he was. We built the relationship. We built the services coming to him. We built his skills while he was where he was sleeping rough. And we are feeling really confident that he's now moved into some accommodation that he has a good chance of being able to maintain. And, you know, I could tell you several other stories of where we've had similar successes of meeting people where they are, keeping them where they are so that we can work with them and prevent some of what David talked about, where that cycle of homelessness just gets worse and worse. And the final point I'll end on, and it's been touched on already, is that housing and supports need to go together. And very often we find people coming into housing and the support is 6 weeks or 12 weeks. And then we see them in our building very soon after when things start to go pear-shaped. And I think that's not anybody's fault. I think it's a factor of the way that we fund services. So there are 5 things that I think in a local government context that we can reasonably do to end homelessness a little more upstream. And thanks for listening, and I'll hand over to Luke now. Thank you.
Thank you, Bev. Sometimes it's quite easy to go last. The stuff on your slides has been talked about a little before by others. It just reinforces that from whatever lens we look at this, there's a lot of commonalities that cut across. I'll share a couple of reflections and insights from a primary health, primary care and an implementation lens. I work with the Primary Health Network that is responsible for a lot of the implementation of programs to support populations at high risk of homelessness and many priority populations across our country. I make the point that when you continue to focus only in the downstream crisis care, that gap between demand and capacity can never be met. Even if you add extra services and focus on the supply, or you act alone with the subject matter expertise that's unique to your part of delivering health and social care services, the ability to impact a larger scale problem upstream just doesn't happen. Creating capability is very important. When capability is created, it does flow on to create capacity in the system. That is best done when you work with your partners in care and you're hearing these same words about meeting people where they are, having enough flexibility in the models to still agree on common outcomes, but have a little bit of agency and a bit of flexibility in the approach. Workforces that are trauma-informed and that are safe, that make people feel safe and trusted, are the ones that perform the most effectively and the most efficiently, and they can create capacity. Another reflection I'll make in working in implementation and looking at program delivery is that sometimes success is about volume. It's about how many people are seen, how many widgets of activity. You divide one by the other and say that service is good value for money or it's not. Success should be about access, equity, and continuity of care. Successful services are there for people who know that in running this race of healthcare or running the race of trying to get support for their needs, not everyone is created equal. And for some people, they not just can't run the race, they can't even get to the start line. And I feel having services that are safe, that are accessible, that provide equity for those harder to reach populations, the people who not just, as I said, struggle to run the race of healthcare, but struggle to get to the start line, it is so important that they are supported. Another thing that's important in our context is continuity. We often get 1 year funding or year-on-year funding for programs without that certainty. I see it like getting a set of Lego, and if you got the Lego one brick at a time, you build something completely different to if you got the whole set at once. People talk about working upstream, but there is always that here and now pressure of responding to crisis. There is capability to look upstream while still working in the crisis situation. There are some critical touch points, some points in care pathways, transitions, exits from custody, admissions and discharges from hospitals, emergency, short stay, urgent care clinics, even something as simple as going to the community pharmacist. At some of these points, some early interventions could be critical to changing long-term trajectories. The next part about integration and coordinating care to improve engagement with folks who are at risk of or experiencing homelessness is really important. Peter showed that circle of confusion or that wheel of woe that even with health literacy and understanding how to navigate the system is still very, very confusing. If we put Jack from David's slide in the middle of Peter's circle, it is challenging. It is very important we co-locate and we work with our partners. It is not the responsibility of people accessing our services to work it all out. It is our responsibility to wrap around them and support them. The last point that I'll focus on before we go into our discussion is that any gains or expansion in services that can be made is a prime opportunity to reinvest upstream. Often the tendency or the pressing need is if an efficiency is created, if some capacity is gained, is that you go to the next person on the wait list and reduce the wait list or improve immediate access to the service you're delivering. True bravery happens when you bank that efficiency credit and move it to a different part of the system. If you get an extra hour in your day, you may be much well served or much better served taking that and educating 50 people who often have light touch with these populations or can't spot risk factors. Moving upstream to help others develop strong responses to weak signals is critical. Homelessness is not something you can see on an X-ray or diagnose off a blood test. The more folks who are aware of some of the contributing factors, some of these levers, who are the people delivering other care services at these critical touch points and trajectories, empowering them with the capability to provide trauma-informed services, to understand some of these risk factors, signals and indicators, and to move people in an early intervention lens and a proactive response truly helps us with turning homelessness from episodic and recurrent and common to brief, rare and non-recurrent. And at that point, I'll hand back to Selena and Carmel and we shall move to our facilitated discussion.
Thanks to all of the four speakers. It's been really great to hear your insights and thoughts. It's time to kind of hopefully unpack some of these ideas a bit more in a conversational manner. And so I have a series of questions which I'm going to throw to all of the panelists. And Selena, I'd like you to feel welcome to join into this part of the conversation as well. And there's quite a few questions in the chat. So if we have time, I'll try to also include those. So, I mean, in listening to the conversation and the insights from our four speakers, I think you each touched on the role of different government sectors and agencies and other key decision-making organisations. So my first question is really to what do you see the role of government and other key decision-making organisations? And when I say government, that can be state, federal and local here in the Australian context, or in other international contexts, however your governments are structured. What sort of role do they play in increasing efforts to support and implement upstream approaches to end homelessness?
Look, I think governments have got to lead the discussion about this. Like prevention isn't part of often what they're talking about. The governments, like everyone involved in these systems, are stuck at the crisis end of things, responding to crisis. And I think it's incumbent on them to sort of carve out space in the discussion, in the strategy making, in the data collection, to focus on prevention, because ultimately, you know, it's not glamorous. I think that's part of the problem we're facing with some of this work. Like the glamour exists at the crisis end, you know, the hero doctor who runs in, or you're out on the homelessness side of things, that you sort of, you're on the street helping people and like doing outreach and like that, you're the emergency department doctor. Crisis is glamorous. That's where the fundraising happens. And if you're going upstream, it's often quite dull. We're doing things like data collection and, focusing on long-term strategies. And so, in summary, governments have got to carve out the space to help us focus on this and to have the measures and the language and the processes to allow a focus on the prevention and upstream, as well as, responding to the day-to-day crisis.
So building on that question, there's a question from Enzo that I think I might throw to Peter and the other speakers, which I think really unpacks some of the challenges that you've just outlined. Like, how do they carve out that space? So Enzo's asking, how do we shorten the distance between policy intent? And perhaps, I guess, part of the question is, are governments having the policy intent to prevent homelessness? But if they do, how do we shorten the distance between the policy intent and the delivery of these prevention activities on the ground? And Enzo's talking in relation to homes, but I think we could also be thinking about the other aspects of prevention. So, Peter, did you want to have a go at that first, and then we'll come to Bev and Luke?
Happy to. It's a very good question. We've got a wonderful colleague in this space, Steve Gates, in Canada, and he talks about the 17-year lag. I think it's 17 years, but in health, between coming up with something that works and it becoming mainstream. It's incredibly slow. And then we're talking about housing in the example that Enzo's using, which we know is this inelastic thing. You know, we come up with housing market assessments and our plans, and it takes a very, very long time to deliver on that. So our starting point is really problematic. It normally takes a long time once we have good ideas to get them mainstreamed. And in the housing context, we already know that it takes a long time to respond. Yet, homelessness is a crisis. It's a real sharp end of a housing problem. When COVID hit, homelessness became the emergency that it should always be seen as, and we responded in a way that mobilised every possible bit of the housing market we could get. Housing allocations in social housing providers in a lot of places became 100% for those who were on the streets. Like we were deciding that they were most in need, and they got access to the housing. And you saw all over the world how the response led to massive reductions of people on the streets. Very interestingly, those countries that really didn't have to change much, like Scotland, where COVID didn't lead to much of a change in response to homelessness, it didn't, because they already had a housing-led response, and prevention was baked into a part of what they were doing. So to respond, basically, we need to be treating homelessness as the emergency that it is. We need to deploy the resources in the way that we did through COVID. And then it was a point I made about housing is allocate it to those most in need. And when you're planning delivery of housing, stop planning just for the market, because the market doesn't deliver for those most in need. It delivers to gain as much as it possibly can. Plan in your housing market for those most in need. And that requires government. So coming back to the role of government, some of the levers here that we need sit purely with government, so they need to take action.
I'm going to take the facilitator's prerogative and sort of ask a follow-up question, but hopefully, any of you can please answer. I think the COVID example is a really, really helpful example, Peter. But here in Australia, one of the things, in addition to prioritising access to housing for those people sleeping rough, we also really increased access to the decent income point that you mentioned in your speech about prevention. We elevated and lifted the unemployment rate, and there was provision of government funding to support those people on incomes where they weren't able to work. How do the speakers see that role in terms of prevention of homelessness? Anyone want to respond to that?
I can. So I spoke to some real life humans, people with lived experience of the COVID response in Adelaide. And I can tell you exactly how that played out. It played out in a couple of ways. In the positive sense, it played out in terms of giving people hope that they might be able to resource their move into a new home. And so when they did get allocated social housing, some of those people actually had already kind of stockpiled a series of household items that they might otherwise have never been able to get hold of. And they actually had some real hope that they might be able to sustain their accommodation. I think there's also the narrative, and I don't know how to verify this, but I know that extra income was also used in other ways that, people use to cope with their really troublesome situations as well. But there was some pretty good data out of other jurisdictions in Australia that suggested that actually lifted some families and individuals out of poverty for the first time in their lives. It was a huge thing, made a huge difference.
Thanks a lot, Selena. That's really helpful. I mean, I guess what you're suggesting is that, a blanket solution of lifting unemployment rates or trying to reduce poverty through income alone is not the only solution. There needs to be a complex array of ways of thinking about prevention. But it is a prevention lever, I suppose, that Peter's identified. Luke and Bev, David, do you have any other comments on that question? And feel free to go back to what's the role of government, if you feel more comfortable in that space.
I'll jump in if I may. I'm just picking up on a comment from Mary Jane around local governments often get pulled into that crisis response. And we do, because at 5 o'clock on a Friday, we are the tier of government that's still trying to close the library or whatever it might be. And I feel like 4 o'clock on a Friday is when we do some of our best work. I think, the role of government at a local level, at the end of the day, that very famous quote, the only thing that ever changed anything was a group of committed people. And so I think it's about how we each choose to use our resources sometimes. And in a local government context, I don't dispute what Mary Jane's saying. You do get dragged into the crisis response. But we also play or can play a really significant role in capacity building, in helping people make connections. I was just at a craft group yesterday and listening to the conversations there around a group of people who are clearly financially really doing it tough. But the things that they were sharing, as they were crafting away about where you can go and what you can get and who to talk to and so on, like that social capital, I think we can play a really good role there. And obviously in the zero projects that, David's much more familiar with, often local governments step in a sort of backbone capacity. So, whether it's capacity, connection, coordination, I think they are good roles for local government to play.
Thanks, Bev. I really love the introduction of social capital. And I mean, that's really a prevention. I'm just going to keep labeling these things that you're all talking about. That's a prevention, like building social capital and community capacity is a really important prevention tool and lever that can be supported and played by local government and lots of other institutions. Luke, did you have anything you'd like to share about this question?
I think the bravery it requires to fund and support for outcomes is really important. I think so often we're looking at inputs and volume and activity, and I did mention about service justifications by being full of patients and having healthy wait lists or clients that need services. I think if we agree on outcomes, and the outcome is that people are safe and supported, people have access, people have information supports and resources to make decisions through a no wrong door system, those outcomes are really important. Sometimes with the short-sightedness or the traditional expectation that busy services are effective services, I think having the bravery to say that, you can dedicate a percentage of your time to the things that maybe not be as measurable within one political cycle or as measurable with standardised industry elements. They're the things that make all the difference, and the ones that are the hardest to measure are sometimes the ones that have the most impact, and that's sometimes what is a bit of a shortcoming of some of the programs.
That's really nice, insightful comment, I think. Has anyone got anything else to say about the issue of governments and trying to reduce the time lag between government's intent and actually delivery of outcomes quite nicely, as Luke said?
Add on governments is... Yep. We tend to, in the homeless space, end up talking primarily to housing departments. Admittedly, I'm really pleased that this has a health domain. Getting health around the table is normally there's often a challenge, depending on how homelessness emergency services are responded to and where the funding lies. But I'm fascinated by who's in our delegate list. Like, do we have education here? How many people from health? How many people from the private rented sector are here? How many people from criminal justice? And I suspect the answer is not a huge number, because at the moment we haven't got there. If you run this same event in 4 or 5 years, hopefully that's your delegate list, because they recognise this is their responsibility, those parts of government, those parts of the private rented sector. And that's the probably our biggest challenge in the homelessness sector. We do have to drive that because they're not going to see it as their responsibility. But we need them around the table. Those parts of government and actually beyond government need to be around the table.
And Peter, I've spoken to David about this a couple of times, about the tables that health traditionally sit at, and normally health like to be the captain at the table they sit at. It's always a control that health is a central player. They are public health issues. They are acute clinical issues. Health often doesn't see equal peers when they sit at some of these tables, and in some of them it's absolutely justified and rightly so. I use the expression, David's heard me use this a few times, about it is important for health to be at the table but not be the captain. It is really important that as part of a team with a dedicated role to play, health can be very impactful and sometimes make the critical difference. But with some of the players in the traditional tables that health sits at, it is important health isn't the captain and is a supporter to hit that same outcome that we're talking about.
So David mentioned in his speech, he talked about in all policies. So it's an area of work really trying to strengthen and break down the silos around how between levels of government, but also importantly across the different government departments, housing, education, justice, transport, etc. And I mean, I think that's what many of you were talking about today, Peter and Luke in particular, that we really need to have these mechanisms, not just where health's at the table, but you need Treasury at the table. You need central government agencies at the table to be able to prioritise these upstream responses in ways that will deliver and reduce the number of people at risk and then falling into homelessness. Sorry, you got me all excited about.
All good. And can I riff off that, Carmel? Like, I think that, you know, what Luke was just saying about, you know, health's got to be at the table, like, and local government's got to be at the table, like Bev's kind of contribution here as well. And also there's not one table. And I think that's one of the things that we've got to map out. So, you know, my thing about government's got to carve out the space to focus on prevention. There's got to be different tables, and we've all got to have those tables aligned. And in many ways, that's what collective impact is about, right? Like you're trying to say, what is the outcomes we're all trying to achieve and work towards that. And there's a whole of society component to that, and there's a whole of government component. And government's got a role to coordinate amongst itself and amongst levels of government. But we as civil society sometimes need to coordinate ourselves in order to hold government to do that, because their attention span is so short and political cycles, and you create interministerial task forces or whatever else it is. But actually sustaining those structures and tables that allow us to focus on those outcomes for more than one political cycle is a big part of the battle. And I think that's, like, Carmel, when you proposed having this webinar to talk about prevention, that's why I really jumped at it, because the Australian Alliance, like, we're not focused on the short-term crisis things. Like, that's not our role. Our role is not to represent the homelessness system. That is what, in the Australian context, we call peak bodies, Peter, that you don't have as many of. But what we are trying to be is that space for civil society to come together across portfolios, that whole of all policies for homelessness. So we've got the table for the health people, we've got the table for the local government people, for lived experience, for justice, and that we're able to work collaboratively with government, not always in the sort of adversarial kind of way that you do need to hold government to account. But you've got a space for focusing on that prevention. So if I was to bring that back to what was your question, what's the role of government, is to carve out the spaces to enable prevention, to enable that collaboration across government. And then what I'd finish with is that in that space, they need to focus on systems, not just programs. And if you focus on systems, we can break the problem up and we can make meaningful change and we can focus on outcomes, as opposed to keep funding programs that can't change systems on their own. And government is addicted to programs, and it's really hard for government to figure out what its role is in systems. But if you want to do prevention, you got to be in the systems space, not just the program space.
And I think one of the examples that I've heard today about that system change was when Peter talked about the duties on public bodies to be able to identify people at risk and then having a responsibility to respond. So that's a very clear systems change. They then need to enable that to happen and be delivered on the ground. But that.
Can I ask, Peter, how's that going?
Yeah, great, yeah.
Well, you don't need the long story. 2014 was a system change piece of legislation, but that was just on local authorities, but it shifted the whole homelessness response into what we call that crisis stage. So when homelessness was foreseeable is where we've now got a plethora of activity in Wales and in England around homelessness prevention. It shifted the system. The new legislation it hasn't got royal assent yet. It's been approved through the Senate like 2 weeks ago. It's been a journey, but that is an example of where around that table you had all those different system actors and signing up to this new piece of legislation. I'll be back in 5 years to tell you how that one goes.
But I think that's an example that, that's an 11-year journey or a 12-year journey to go from that kind of system change to actually then the next step along that journey to be able to deliver the impacts. But we do have a couple more questions and we have a little bit more time, so I will move on. But I think this has been a really exciting and really stimulating conversation. So the second question we're really interested to explore is, are you able to share examples of other issues that people have taken an upstream approach to prevent, that we could then repurpose to kind of think about how we might be able to apply within the and apply to the homelessness sector and the homelessness issue. So are there examples of how prevention approaches have worked to address other societal problems that we can explore, repurpose and adapt to help us address the issue of homelessness? Yeah.
The health is a really good example. Like prevention is so baked into thinking in health. There are just so many examples. But the generic example I'll take from health is routine screening is just such a baked in part of what we do. And whether it's in cancer prevention or in name any area of health, you have screening. Dentistry, the same. You have screening, and then you have action to prevent. But the takeaway is screening, identification, and we're beginning to do that in some places across the world around risk. This isn't dealing with the universal prevention stuff, which is make sure everyone has good health or everyone has access to housing. This is still waiting a little bit late, but where there are signs that something might be going wrong. I'll give you one example is the kind of in the US for veterans, you have almost a parallel healthcare system delivered by the Veterans Authority. They bake in 2 questions to their annual checkups. Basically, how are things with your housing now and how are they likely to be in a few months' time? Basically, is there going to be a risk of you becoming homeless? And then we'll act and refer. Like just baking in those 2 routine questions. The drivers of all that might be economic, it might be related to other stuff going on in somebody's life, relationship breakdown, that you then deal with. But the signs can be picked up through routine screening. So there are examples, and we are beginning to take some of those lessons in.
I would call that secondary prevention, but really important to address early intervention.
I was just going to say to Peter, imagine if when we've got, and pardon the use of the word, a captive audience in a prison, and we ask that question about what your housing situation might look like on release. We have some really clear intervention points actually, and we have some pretty good data around what outcomes look like for people that come out of particular institutional settings when they come out of those institutional settings. But we also have really clear information out of things like by name lists and the work that the Australian Alliance is doing around where some of those intervention points could have been that might have changed someone's path ahead.
Can I jump in next, Carmel?
Yeah, of course.
Just riffing off what the other speakers have said, the point that's floating around in my mind is about transitions. And in so many life stages, we put together whole packages of support. So if you're becoming a new parent, there's all this information that's kind of packaged up for you. If you're transitioning to school, we've got a whole process about how you transition into reception. I think we're getting better at some of that, young people transitioning out of care, people transitioning out of prison. But if you are at risk of being homeless, there is no package of supports that helps you navigate or stop that transition. It's not a very well articulated thought, but I feel like there's something in that space of transition where we could stop some people ending up on the street tonight.
And Bev, I totally agree with you. And even some of our gateway services, and I'm not just talking about South Australia here, but those services that are funded to point you in the right direction for housing support and other support, then they're loaded to crisis. They're not loaded to prevention. So it's not about me ringing up before I get the eviction notice and saying, what do I do? Because if you do that, they'll say, I'm really sorry, we can't help you. So, you know, we actually don't have some of the mechanisms even in the system yet around, you know, what you do in that situation. So, Peter, that's one of my questions for later. So maybe it's a good time to insert that now, Carmel. But have you seen any examples of, you know, in your typology of where we're working just above the crisis point, between the crisis and the upstream, to actually do that kind of prevention, like that bit where you don't get the eviction notice?
Yeah. So, and I'll give you the best example, and I've talked about it a lot, and it's taken up a lot of my life, and it's Australian. The Geelong Project, the Albury Project, you'll all have heard of it, is the best example of that. That is a school-based screening tool that identifies young people who are at risk of homelessness, typically because of family and relationship breakdown. And it is the only tool that actually asks young people, just give your voice, tell us that something's going on at home. And for 50-60% of the young people, schools have no idea that those young people had something going on at home. And if their schools do tell you, oh, we knew that there was something up, they knew that there was something up around attendance or performance, not about what was going on at home. And crucially, it's not just, is there a risk? It's, and now we're going to support you and your family, and we're going to work through that. And there's an intergenerational effect, because if you act then, homelessness doesn't happen, and all the other things that come after it don't happen. So that is the best example of something in that space. I'm trying to do the same work now with some employers. So we're working with Homewards in the Royal Foundation to try and enact some of the similar questions or similar principles with employers. Ask your employees how they're getting on, and then within your own resources, do something to help them with their rent or the relationships, whatever it is, point them to supports and provide.
And if you Google Upstream Australia and the Geelong Project, you'll find out more about it. It's brilliant. I might jump in there with another example. And if I was Prime Minister for the day, this is the example that I'd copy. So when I was in Finland, they have a universal prevention program. So like it's for everyone. It's housing loss prevention. And they have a bucket of money available to use. So in Australia, it's not much of an exaggeration to say when you call the homelessness hotline, they'll often tell you, call me back when you're actually homeless and I'll do something about it. And whereas in Finland, if you call that number, it's like the equivalent of a 1-800 number. Everyone in Finland knows about it. It's like Beyond Blue or, you know, Lifeline in Australia. Like, who do you call in Australia if you're experiencing homelessness? It's a quagmire. Even in particular jurisdictions, not even between them. So I'd create a universal 1-800 number, and then on the other end of it, they're there to help you prevent your loss of your housing, to manage you through those transition points that Bev was talking about, not manage you, to support you through those transition points. And importantly, giving them a bucket of funding that's available to be like, hang on, I'm about to lose this. If I could have just paid the $40 that I need to pay on my energy bill, that then, this is a case study that Selena and I came across once. It was $40 that then led to decades of homelessness and if we just, somebody could have given them the $40 that they didn't, they'd run out of that social capital and they just needed a lifeline at that point, would have prevented so much cost, so much heartache. So anyway, Finland's a really great model. You know, I think if you're doing prevention, there's an element sometimes need to be universal that everyone's aware of, because we need to get to the people before they realize they need the help and before people are even using the label homelessness. Like, you know, we don't, if in 100 years' time, we don't want to be talking about homelessness. We want to be talking about housing sustainment, and we want to talk about helping people through life transitions. And if we can get that right, we will have solved the other problem.
I'd like to share a reflection, Peter, on some of those comments about success of those type of programs where if you went into schools or you went into some of these areas and told people and took a resource and a toolkit, they are not effective. I've seen it happen many times with things like immunisation and heart health and management of obesity. When you go in and tell someone, it is a completely different narrative to when you go in and you ask and you do things with people, you don't do things for people. And creating that safe space, we've seen in our Aboriginal community, there's some excellent examples in Aboriginal medical services and shared medical appointments and community yarn-ups. Just being there and having that trust, people will tell you, you need to have an ear. You've got two ears, one mouth for a reason, and having the ability to take those inputs in and actually listen to people, meeting them where they're at, that stuff is critical for success of programs. And I feel like a lot of these programs that go in telling could do far better if they went in asking.
Very important point, Luke. I think we might move on to the last question because there's only a handful of minutes left, and I want to give Selena her time to be able to do the raconteur summary bit. But I do think this is an important question, and perhaps I'll ask each of the speakers to provide like a fairly brief response. So with all of the discussions we've had today, I guess, you know, David and others have suggested that actually at the moment it's the homelessness sector that's largely talking about homelessness, the housing and homelessness sector to some extent. But to what extent do you feel that the homelessness sector is ready to be able to advocate and support increased action on upstream approaches, which really requires to move beyond the homelessness sector to other sectors, other parts of society? And if you don't think that they're ready, then what strategies do you think we should put in place to help support the sector, you know, make this shift?
I'll probably talk more about the sector. If it's not ready, what can be put in place to enable that shift? I've seen so many things that people are saying the same thing, but it's in their native tongue. It's in their own language. I've seen people talking fluent clinician, people talking fluent patient, people talking fluent bureaucrat, and people talking fluent, I call it nerd, but we'll call it finance, performance and activity. They're saying the same thing, yet they disagree with each other. They can't understand. I think the sector desperately needs a translator so that these messages make sense in the currency that people deal with every day. For an industry and for an area that is so complex and hard to measure and capture, most of our programs are called zero. It is such a simple indicator. It makes so much sense. It's so clear. When you have most programs would be very envious to have a single target that everyone understands and is universally understood. I also love the idea about people not having to spend one more night being homeless than they absolutely have to, and how many nights we save. I love a bit of mathematics, and if 275 people were like Jack, who were, let's say they were 10-year homeless people, homeless for 10 years, 275 people, that is 1 million nights of being homeless. Think about what we could do for 280 people as a country to prevent 1 million nights of homelessness. Making things like that to understand, we do these sleep outs and everyone has to experience it for one night. Imagine 1 million nights, and it would only take the prevention of 10-year homelessness in 274 individuals to save us 1 million nights. Those sort of lines are memorable. Those sort of lines would stop someone in a community pharmacy or an early learning centre and go, hang on, I could be one of those 270 and work towards 1 million nights. I think we have to frame it in language that means something for different people. That same representation is 11,000 people who would spend a full winter on the streets. That's what 1 million nights of homelessness is. So I feel like to get the sector ready, to have some strategies that change the narrative so people understand it in language it means something to them would be critical. I'll hand over to someone else.
So I think what you're talking about there is being able to reframe the arguments, being able to tell stories that not personalise it, but also the significance and the scale of the issue, and providing them with clear ways that they can think that we can make a difference, so they feel empowered to act rather than feel hopeless and overwhelmed.
And I think I might jump in there. Like I'd say my answer to your question, Carmel, no, we're not ready. But what we're trying to do is get ready. Like that is essentially what we're trying to do with Advance to Zero is, and I love that framing you've just given us, Luke. Like the zero framing we've got, but how do we measure progress? Because there's such despondency about this challenge, and we've come complacent that somehow this is inevitable or an inevitable consequence of the way we manage our economy. It's not. And the way in which we can solve this problem is by better measuring. It's not the only solution, but we have such poor measurement and data in Australia on this challenge. And what Advance to Zero communities are able to do is put a data system in place that can calculate exactly what you were just doing, Luke. And I think we need to do that, Sel, to say how many million nights of people homelessness have we prevented. And we can tell that with the data we're collecting in local communities. We just haven't told the story as articulately as you just put it. So thank you for that provocation. But my answer to your question is, Carmel, no, we've got to get ready to do this. And the first step in that, in my opinion, is having good data that you can use to inform your storytelling, inform your improvement efforts, because communities have been able to drive that level of improvement by collecting data, notwithstanding the fact that the overall system is in crisis and in many times bad, getting worse. But we have agency within the systems we work in, and you can challenge and change those systems if you have good data. I can't believe how many times I've said data here, because I used to think data people were those nerds, Luke, that you were talking about before. But I've completely become a convert in this job.
Thanks, David. And I think, obviously data is a tool, and it's a really important tool, but how that data is framed and shared and engages with others.
Just add political will. One of your strategies is you need political leaders and people with lived experience, your advocates and your drivers, get them on board.
Yeah, but the framing will help drive the political will.
I'll add a really brief comment, Carmel, which is to say that my sense is that the sector, and by sector I mean the people working at the coalface, are exhausted. The caseloads are getting higher, the complexity of the people that they're working with, and it feels unfair to me to ask the people who are doing the hard yards on the front line to keep doing the heavy lifting in the advocacy as well. And I think that's where we all have a part to play, and I'll leave it there.
Really helpful. So thank you for shining that light. So Selena, I'd really like you now to invite you to provide a bit of a summary, some challenging comments, and perhaps point where we might be able to move forward. And that's how we'll wind up the day. And I'll come back and give people a bit of background on what next. But over to you, Selena.
Yeah, awesome. Thanks, Carmel. So I think, look, and I've been monitoring the chat as well, just to see where people's thoughts and questions are as well. It's a really interesting conversation, even if you just kind of, glance over that chat to see where people's thinking is and, where they're pushing some of these thoughts to. I think, look, really, really useful advance in our conversation. And I say advance deliberately because prevention's always been that piece that's kind of been missing from the homelessness conversation, the homelessness puzzle in many ways. I think we've had attempts at doing the homelessness prevention work in the past, and some of those have been reasonably successful. And I think where they have been successful, there's been very particular conditions supporting that success. So if we think of Kevin Rudd, when he was Prime Minister, his great declared national shame was homelessness, and there was a real focus in a national policy that was very well evidenced and very well thought through, in my opinion, for the most part, around understanding what homelessness looked like in this country, and also understanding where the levers are and where some of those intervention points are. And so we had that federal buy-in, and we had the floor politically, I guess. And similarly for South Australia, and apologies for it being, a South Australian-centric kind of point here, but when we had our social inclusion unit, we had a real focus on that kind of prevention piece in the homelessness conversation as well. So how do you wrap the right supports around people who are sleeping rough, for example, by understanding their actual specific needs, like talking to people, asking them, like what Luke says, getting down and having a chat to people, asking them what they need, asking them what their challenges are. So I think we have got some examples from the past of where we have made inroads, but it really requires that higher level political buy-in. I think the other thing that everybody has touched on in different ways, which I'm really pleased to hear, is actually the resourcing conversation around this. I don't think that we're ready, like David, for this conversation about shifting the focus back to prevention when we've got such an acute level of crisis. And I think that I'm quite sympathetic to the view that I hear in the sector all the time around, if we're going to do prevention, it has to be additionality, or it has to be diversion of resources from other systems. And I guess my sort of provocative question, and I don't mean this in a way that is offensive or judgmental to anybody, is really a question about the public health piece in all of this, which is where is the space for more public health intersection into the homelessness conversation? Because at the moment, I don't feel like it's quite there. Like, I've just been involved in putting together a proposal for some research, knowing that we have one specialist GP in the city serving rough sleeping people specifically, one in Adelaide. That's not a lot of capacity. Like, that's only one piece of the system, like, admittedly, but, you know, where's the forum for having that conversation where health does get back involved in this conversation? They have been highly involved in the prevention piece previously. We had a no discharges from hospital into homelessness policy. It lapsed. Like, where do we get that buy-in back into the conversation? I don't know who the best person is to answer that. It's kind of me being a bit provocative, because I'm not sure that health's really around the table in the right way. I don't think health sees it as the human service that I see it as, and we're too disconnected in our kind of human services landscape at the moment.
I mean, maybe I'll respond to that. I think that the health system operates a bit siloed as well. And I think where prevention sits within the health system is completely separate to the clinical emergency acute health system. And probably in the same way that you're talking about frontline service providers in the homelessness system, I think the frontline services in the health system are really struggling. And so I think how the health system's carved out the space, and it's not without its challenges, is to make a whole focus on prevention. So the state government here in South Australia has established a prevention agency. In other countries, in other jurisdictions, they actually fund those prevention agencies separate to the emergency health system. And maybe these are the conversations that we need to be having about reflecting on what Bev's suggesting, that actually the frontline service providers in the homelessness sector are under stress and are struggling, that we need other systems that work alongside them that can take some of that early intervention, that screening work that Peter's talked about, and that further upstream lobbying work to get other parts of government and whole of government systems and other systems, including the private sector. I can see there's a gentleman who's made a comment about the private sector, including the private sector, to really take on that broader prevention approach.
And also philanthropy. I know someone mentioned philanthropy and what philanthropy's role might be in this space as well. I think my other reflection on the basis of a number of things that have been said is there's a clear role here for Treasury. So I often come back to this same thinking, which is purse strings, right? So how do you get buy-in from a range of agencies across government? Well, you do it with the purse strings. So if Treasury is at the centre of the conversation, now if we think about the COVID response in South Australia in particular, but also in other places, what was different? People were worried about their public safety and their public health, first issue. Hence, let's get everybody off the streets. We had huge levels of coordination of services around that, but we also had Treasury carrying the entire cost, basically, of that entire response. And that's how we ended homelessness in Adelaide, at least temporarily, because Treasury carried that cost for quite a long time, including some of the cost for ongoing, although time-limited support. So I feel like, and maybe, David, this is a conversation for you and I at some point, I feel like there's the layers of government buy-in. Treasury's got to be right at the top of that conversation, and then we've got to think about what the layers look like underneath that to get that coordination around advocacy and then around action. I also think that, a lot of what we're talking about in terms of the advocacy piece here really requires resourcing itself. So that advocacy bit is almost always never resourced or never recognised actually as a really valuable activity. And so nobody has full responsibility for it, because a whole heap of people on the smell of an oily rag are carrying the cost. And so, I think about, Bev, some of the work that local government's doing, like the social workers initiatives and a whole range of other things. And that coordination and sharing and learning around all of that's so critically important. But local government's so busy doing what it does anyway. Like, how do you do that coordination piece to share with state government, or to share with the federal government, or to share with the homelessness sector? Like, I feel like there's a resourcing conversation that needs to go alongside some of this, and that might take some of that burden off frontline workers that we're talking about.
I mean, I think they're really great points, Selena. So, but I guess, how do we get Treasury, federally, state government, local government, to be able to provide those resources? How do you get the resources to be able to do the advocacy? And I think it is about those of us who are really interested in wanting to kind of address this issue. We have to play a role in that ourselves.
We do.
And we have to be advocating. We have to be bringing people together, and recognise, so the sector does need to kind of come together, but obviously recognising they have limited capacity, I think, is really important. I feel like we could continue this conversation for another hour, and I've just really been enjoying the discussion, and there are many challenges to overcome, but we are at time. We're a minute over, so I might bring it to a close, and we're going to summarise some of the key conversations, and maybe this point that we landed on at the end about how do we actually move upstream, given that the sector's so under crisis. How do you go about generating capacity for a stronger prevention activity, picking up on a lot of the points that Peter and Luke and Bev and David have suggested. But we'll write that up into what we call a policy brief, and it will get published in a journal of interest to the housing and homelessness and health sector, hopefully, and maybe even whole of government. But with that, I just really want to thank all of our speakers for your wonderful insights and time today. Did a lot of great learning. And I want to thank you all for joining us. If you want to find out more about the Centre for Health and Policies, or have a look at other In Conversation discussions that we've held, please go to the Centre's website, and feel free to stretch out to us and the speakers. So thank you very much.